Hi guys, it's your girl Miss Temi Love and welcome back to my channel. Thank you guys so much first of all for your engagement on my last video, and please let's keep up the same energy, okay? On today's video I'll be doing a Q&A. I did a few Q&A few weeks back on my WhatsApp. I told people to ask me anything they wanted to know about sickle cell. Curious questions, weird questions, ridiculous questions, anything you wanted to know about sickle cell, and I got a few questions from friends as well, and I definitely went on Google and picked up a few questions that piqued my interest. And on today's episode we will be going through some of those questions because there are a lot and I really don't want this video to be long. Okay, so let's get into the video, guys. Alright, welcome back. So I don't know if now is a good time to vent my frustration on how many times I have tried to film this video. My phone is really messing up, my mic is messing up. I don't know if it's my village people that are following me today, but anyways, I'm going to make this video and you guys are going to see it. Alright, so let's start. First question. This person said, what is the highest or worst thing that can happen to a sickle cell warrior? What is the highest or worst thing that can happen to a sickle cell warrior? Alright, so I think this person is trying to ask like complications. Yeah, that's my understanding of the question. Like complications that can happen to sickle cell patients. Alright, so there's so many complications. The list goes on and on, that sickle cell patients can actually have, and I'm going to read a few of them to you guys. A sickle cell patient can suffer acute chest syndrome. A sickle cell patient can suffer anemia, avascular necrosis, blood clot, fever, infection, kidney disease, and so on and so forth, right? So I'm going to give you guys a little a little bit of one of my own complications. So I do not have a spleen. Let me say that again in case you did not hear right. Yes, I do not have a spleen. This happened so many years back, like so many years back, before I even got into the university. So if you do not already know this, the spleen is a very important organ in the body, right? And I guess my own was overcompensating and it just disappeared. It was not surgically removed or anything, it just vanished, right? And I guess my other organs now are doing the work. But anyway, the spleen is very important and I lost mine, and yeah, that's one of the complications. I don't want to go into all the other complications, but that's one that I have personally faced. So yeah, there's so many complications, and I think there's really nothing we can do or much we can do to stop some of these complications from coming. So basically we just try to stay as healthy as possible. So yeah, that's my answer to that question. The next question, the person says, can I kiss a person that has sickle cell? Can I kiss a person that has sickle cell? Well, my answer to that question is hell yes. I mean, why not? Sickle cell, first of all, is not a contagious disease, okay? Get that, it is not a contagious disease. So if there is any sickle cell person you are liking, come on, shoot your shot, but please make sure the person has the same feelings towards you, and make sure that your genotypes align. I beg, I cannot overemphasize this. Alright, so the next question says, at what age does sickle cell show up? At what age does sickle cell show up? So there's no age that it shows up. People that have sickle cell are born with it, right? They are born with it. So you can check your child for their genotype from as early as 3 months old. But right now in this time and age, we have so many technologies and all of that you can use to check all of those things. So, but I know that if you're giving birth to the child already and you want to know their genotype, as early as 3 months, you can definitely know. So sickle cell doesn't just show up. It happens because of the parent's genotype, right? So yeah. This question says, do sickle cell warriors pretend? Do sickle cell warriors pretend? Okay, I think I'm going to align this question with another one that I have here that is similar. Okay, so this person says, my sickle cell friend does not like going out. I feel like she lies with her health. Right? So that's another question, but it sounds almost the same as the sickle cell warriors pretend. So the answer to these two questions is, first of all, I personally do not think that any sickle cell patients pretend, and I don't think they should pretend. If you are in a situation or circumstance that you are not available to do one or two things, let your friends know exactly how you're feeling. You don't have to pretend to get out of chores or outings or whatever it may be, right? So even in my house sometimes, like, whenever I'm in pain, like, when I wash plates, even though you're having pains, just force yourself, do one or two things. You understand? So for instance, whenever I'm trying to like just do a little bit of chores here and there, I rest a lot, right? So let's say sweeping the house that would normally take me maybe 15 minutes would now take me 30 minutes because I really get tired a lot, right? And I don't think I'm the only one that goes through this. A lot of sickle cell patients actually have like weak immune system, right? I'm not saying my immune system is weak in Jesus' name, because they'll come and say now that she's saying her immune system is weak. She's not a believer, she's not a Christian. Anyways, yeah, so I really get tired a lot, and imagine I just finished arranging the house, something that will take me 15 minutes and I use 30 minutes because I'm sweeping and I'm stopping to rest. I'll sweep small, I'll rest, I'll sweep small, I'll rest. Imagine finishing all of that, right? A friend now comes and says, how far? Let's go chill. Nigga, babe, I'm not going to answer you because I'm really tired. So that's just a scenario, okay? So generally, I think sickle cell patients really do get tired sometimes. We don't have like all the energy that normal people would, have. So I think you should speak to your friend, know what exactly she's going through, know why she's pretending or if she's pretending at all. And I don't think sickle cell patients pretend. I'm not gonna lie, I've had that come to me a lot of times. People are like, I bet she's using her health as excuse, right? I've gotten that a couple of times, I'm not going to lie. So like I said, get to know that person, ask more questions, and see if there's a way you can encourage them. Because sometimes whenever I'm feeling down and a friend comes to visit, it uplifts my spirit, and I'm even forgetting that I was even tired or anything like that. So sorry guys, I'm really trying to rush. I don't want this video to be too long, first of all. Secondly, the lights never don't show their safe. I don't know if the lights will come back, but I just really want to rush it so that at least you guys get the point of the entire video, right? My energy is on 0. Sorry, let me deviate a bit. My energy is on 0 because I've tried filming this video approximately 4 times now. The first time I was filming, my mic wasn't working. I filmed for about 30 minutes and my mic wasn't working. I had to start all over. Second time I was filming, I didn't know that my phone was saying battery space, like there was no longer space on my phone. And then I continued again, and everything has just been against me, to be honest. So I was really hyped when I started, but now I'm a bit anyways, but don't worry, the vibe is still there. I'm gonna try and finish this video today. I hope you guys can still see me because the light was really helping, and at least there was fun on my face. Now I'm sweating and there's no light. Okay, so this is my plan B, okay? Forgive me, but I'm going to fan myself a lot in this video. You all know the situation of the country, right? The heat. And so yeah, don't judge me. Anyways, next question. This person says, how to handle someone with sickle cell sexual healing. Sexual healing. How to handle somebody with SS sexually. I think it's a personal preference, to be honest. How I would want to be handled is not how somebody else would want to be handled, right? It's not even a health thing, but I'm not going to deny that the health can be a stumbling block sometimes in that department, right? Because you might be feeling weak or might not be able to perform as good as you want to, and all of that tiredness is definitely one of the things that sickle cell patients go through a lot. So imagine somebody wants to, and you're tired, or while the thing is going on, you're just so not into it again because you're like tired, and there's a lot that can be involved, right? So personal preference. There are some sickle cell patients that in that department are like, their health is not even a stumbling block in any kind of way. So I can't speak for anybody. I just feel like it's a personal preference. So yeah, know your partner. If you're dating somebody with sickle cell, just ask them questions like, how do you like it? What do you want me to do? You know, it's a personal preference, to be honest. Next question. This person says, what is the worst complication you have had? Okay, sorry, same question. Alright, so like I said, I really do not want to talk about all the complications I've had, and I'm not sure I'm ready to open up that much. But like I said, I do not have a spleen. Start the video afresh. Start the video from the beginning and you'll see that part. Okay, so does sickle cell affect, does the weather affect sickle cell patients? Yes, 100%. When it's too cold, you definitely get affected. When it's too hot, you definitely get affected. The weather definitely affects us in some kind of ways. So like when you're cold, it can cause joint pain, you understand. When it is too hot, it can cause dehydration for any normal human being, not just sickle cell patient. But yeah, it causes dehydration, weakness, you know, and all of that. So definitely the weather actually affects us in some kind of way, and that is why some of us, hey god, this is my mic, I hope it's working with this thing I'm doing now. Yeah, so that's why some of us try to take extra care, you know, when it's too cold or too hot, or the weather is just, you know, turning on your own. So yeah, the weather does definitely affect sickle cell patients. Okay, that's the answer to that question. Can two sickle cell patients get married? When I saw this question, I definitely knew this person was pulling my legs, because what the heck? Why would you even ask that kind of a question? Of course, no, you cannot. I actually the why meaning. You definitely cannot. Two sickle cell patients cannot get married. Don't try it. And I know a lot of people actually consider it because they're in love, you know. Love don't blind your eyes. I beg, don't try it, please. For the sake of yourself, your future children, please do not try it. Both of you should just give each other brotherly and sisterly love and let it end there. I beg. I cannot overemphasize that sickle cell patients you cannot join together. I beg, don't try them. So this person says, why are sickle cell patients skinny? Yeah, definitely. This question was directed at me. The person actually said, is it because you have sickle cell you are skinny? And so I just changed the question like this because it's actually almost a general question with sickle cell patients, right? Some of us are really skinny. I mean, I've not always been this skinny, but I guess my health deteriorated at some point, and it definitely affected my physical outlook. But I'm working on it, so I'm definitely working on it. I definitely don't want to look like this forever. And trust me, it's not like I have the power though to change a lot, because I'm not a foodie. First of all, food actually enhances your physical outlook. So I don't even eat enough, first of all. And then even though I now eat, like, I think because of the disease, it's not so much I can do. You know, there's not so much I can do to say I want to be fat, or I want to be this, I want to be that. I've just come to accept the way I am and then see how I can help myself. When I mean help myself, I mean eat better, exercise, sleep better, all of that. That can also help me look, you know, good and all of that. And someone actually asked this question also. The person said that I noticed that some sickle cell patients are deformed. I don't know what you mean by deformed, to be honest. But I'm not gonna lie, I've definitely seen sickle cell patients with, you know, like big stomach. Some have like other issues, and yeah, I have bow legs. I don't know if it's because of the sickle cell, because we have bow legs in my family, but I think mine is a bit worse because I had a surgery when I was pretty small. I had a leg surgery, and so yeah, I think that is also one of the complications of the sickle cell that I had. And so physical outlook, we cannot really work on that. It doesn't mean that there are no sickle cell patients that are actually fat. Trust me, I've seen sickle cell patients that are plummy and they look really healthy. You know, some of them is because it's a family thing. Like when you look at every other person in the family, they have body, and and some of them is just because it's just their body type. You get, it's just their body type. So yeah, not all sickle cell patients are skinny, and even though they are skinny, there's really not much they can do about it. That's my answer to that question. What is the difference? Okay, yeah, this question is very dear to my heart. I don't know why, but please listen carefully. What is the difference between having sickle cell and having sickle cell traits? So we want to know the difference between having sickle cell and having sickle cell traits. So first of all, unlike sickle cell, I'm reading this from Google, so probably you should also go and read and know before you get into any relationship or partnership with anybody. So unlike sickle cell disease, a serious illness in which patients have two genes that cause the production of abnormal hemoglobin, the substance in the red blood cells that carries oxygen, that helps carry oxygen. Individuals with sickle cell traits carry only one defective gene and typically live normal lives. I don't know if you got that, but I'll put it on the screen for you to see. Right? So I have sickle cell, and my younger brother has sickle cell traits. It's in the family, right? My other sister, however, does not have sickle cell traits. I don't know how to explain it, but there is definitely a system to it. I'll see if I can get more information about it and add to this video. But yeah, there's a difference between having sickle cell disease and having sickle cell traits. Please read about it. Don't take my word for it. Is it truth? No. There's a difference. I mean, don't take my word for the little explanation I've given. Go and find out more about it. Okay? Okay, yes. So this very question is something I have wanted to talk about in a lot of my videos, but there was never really enough time to elaborate on it, and I still might not elaborate on it, but I just want to say a few things about it, right? So this person says, my friend who is a sickle cell is addicted, and you know anyone going through it, or how can I help her? This person has a friend going through sickle cell, and the person also has an idea or knows that her friend or his friend is addicted, and so the person is asking, do I know people who have this addiction problem, or how I can advise her or him to help his or her friend? Okay, so first of all, make sure you know for sure that your friend is an addict. Either the person has confided in you and told you that they are, and that's how you know. Please make sure what you're saying is right, because a lot of sickle cell patients get accused for being addicts. I have been accused a lot of times of being an addict. I have met a couple of sickle cell patients that have been accused of being addicts, and even online I see sickle cell patients that have the courage to come out and talk about their condition, talk about addiction, and how they also have been accused of being addicts. Now, addiction is a very strong thing. People just say it like it's a simple thing. Addiction is a very strong thing. Personally, I've had friends call me addict. Family members have suspected. My doctors have called me addict. My nurses have called me addict. Like, sometimes whenever I have the time, I try to explain as much as I can. I try to explain, like, I'm not an addict. This is it, this is it, this is it. We definitely take a lot of drugs, I'm not going to lie. Not all sickle cell patients take a lot of drugs. Some already know what works for them and they just stick to it. Some are still trying to navigate what works for them. I think I'm one of those people, because I do not want to always take painkillers whenever I'm having pains, right? Because it would seem like that is the only result. And then definitely if you're having pains and you're in the hospital and you're telling the doctors, please give me so medication. I don't want to call any medications now, because narcotics, opioids and all of that, I don't want to say it on camera. So imagine you're telling the doctor that they should give you this particular injection or drug, that it works for you, and then what you get in response is you're an addict. Or you tell them, oh please, so milligram is too small for me with the severity of the pain I'm having right now. Can you please increase the dosage? And they're like, you are reliant on it, you're an addict. So I can give a lot of instances, right, of where addiction has come into play whenever this topic of sickle cell is being discussed. So I personally would recommend a rehab. I recently saw a video from Sickle Cell Motivator. Yeah, you can check out on Instagram, Sickle Cell Motivator. She posted a video about addiction for sickle cell patients and the steps they can take. So you can definitely check her page. So rehab was definitely brought up. I don't know, I've never been to a rehab before. Though I've been accused of addiction, I'm not an addict, and I pray that I don't become one, because it's not an easy fight. Being a sickle cell patient and then battling addiction at the same time is a struggle, and that's why my heart goes out to any sickle cell patient out there struggling addiction, right? Because how do you get the help you want? How do you actually go and meet somebody, or even your doctors, and tell them, please, I need help, I'm an addict? How do you say it? If you're a sickle cell patient out there already getting the help you need, please try to reach out to other sickle cell patients and see if there's a way you can be of help to them, especially those that are going through this situation. So yeah, back to the question. Speak to your friend. Try to see if you can speak to elderly people or people older to assist, to see if they can help, right? Don't just keep the secret for the person, because it will just keep getting worse. That's just the honest truth. See how you can help them. Definitely see how you can help them. So definitely rehab. And if the rehab thing doesn't work, because I don't really know how rehab works. I don't know if we even have rehab in Nigeria. I'm sure we do. We have psychologists, therapists, and all of those, right? So I think those are the processes, and then you should definitely see a doctor that will probably maybe give you drugs that will help the craving stop, or I really can't say much about it because I don't know much about it, but yeah. And at this time, definitely be close to that friend, because addiction leads to a lot of things. It can cause depression, it can cause suicidal thoughts, and so much more. So please make sure you're also close to that person, or if you know anybody suffering addiction generally, not just with sickle cell patients, try as much as possible to be very close to them. Encourage them as much as you can and see how you can help them, right? So that's my 2 cents about addiction. I can definitely go on and on about it, but I really just want to stop there. So yeah, this person said, how do I date someone with sickle cell? How do I date someone with sickle cell? Okay, I need a break, because this question, I don't even know how to go about it. How do I date somebody with sickle cell? Okay, I'm going to use myself as a typical example, okay? So I'm sickle cell and you're asking, how do you date me? First of all, you have to be prepared. Prepared in the sense that you already have to know my condition. And this is where I would advise sickle cell patients, before you get into a relationship, please let your partner know that you have sickle cell. Don't hide it and say they might not like me if they find out. I beg, just be on the safer side, because that relationship might lead to marriage. You can never tell. So make sure your partner knows your condition. And partner, when you find out that your person has sickle cell, you have to mentally prepare yourself, because it's not easy, to be honest. It's not easy. Personally, I try to do all the work. I try to hide my pains. I try to take care of myself. So even if I'm in a relationship, I don't really want my partner to have that burden on them, right? I don't want them to have that burden that, okay, he has to take care of me. She's sick again, we have to go to the hospital, all of that. So as much as you can, help your partner that has sickle cell. So alright guys, I hope you enjoyed this video as much as I actually enjoyed making it. It's been a horror movie, but I made it. Yeah, I made it to the end of the video. But yeah, I hope you guys enjoyed watching it, and please don't forget energy. E for energy. Like, comment, subscribe, call your friends, tell them there's this chick, she talks about sickle cell, you know, it's very educational, you should learn one or two things. Tell them to subscribe as well. And I should just put this out there, my channel wasn't actually supposed to be about just sickle cell. I had an entirely different vision for my channel, and I'm still going to get there for sure, because what I had in mind was showing people that sickle cell doesn't necessarily need to be a death sentence. So I wanted to show people the other side of sickle cell. Sickle cell patients that are flourishing, sickle cell patients that are doing big things out there. Sickle cell patients that when you hear that they're sickle cell, you'll be like, are you for real? Adekole Gold, for instance, right? So yeah, that was where my channel was supposed to pick up from. But yeah, I think I'm just going to make myself a typical example of what I'm trying to put out there, because like I said from the very beginning of this channel, if you watched my intro video, you will know that I talked about being very intentional about life and trying to live my best life. And so yeah, the sickness has put me down so much, and I just want to come out of my shell, be myself, enjoy life. And so yeah, you guys are still going to see that side or that vision of the channel, because it's definitely getting there, right? So yeah, just make sure you stay tuned, okay? Make sure you stay tuned, and you're just going to keep getting back-to-back interesting and educational movies. Sorry, I wanted to say movies. Back-to-back interesting and educational videos from your girl. So if you have any questions concerning everything I've just discussed, or questions about sickle cell, please do make sure to put your questions in the comment section. Please, for people that come to my WhatsApp to tell me the video was nice, the video was this, please put the comments here on YouTube. I want the comments here, please. So thank you guys again for watching so much. Like I said, keep the energy from the last video, okay? Definitely keep the energy, and I do hope to see you in my next video. Thank you so much for watching. Love you. Bye. Oh yeah, cheers to the end of the video, of course. Okay, for real this time. Bye.